The new Omicron variant of coronavirus is likely to pose a very high global risk, and some regions will face severe consequences from it. That's the warning from the WHO, who's advising countries to accelerate the vaccinations of high priority groups. 13 countries we know now have reported confirmed or probable new cases of the variant. But what has not been established yet is how transmissible or dangerous it is, or how effectively the current vaccines will protect against it. There are more than 30 mutations in the spike of this new variant, which is the part of the virus that vaccines train the body to recognise and attack. And 26 of those are unique to Omicron. That's compared to 10 in Delta, 6 in Beta. Amid fears of another global surge of the virus, many countries have begun imposing travel bans. Japan the latest, Australia as well, delaying the next stage of its reopening. The UK, EU and the US have already announced restrictions on entry after South African scientists identified the new variant last week. Well, let's hear now from the WHO's Director General, who says the emergence of Omicron means that we can't afford to let our guard down.
We don't yet know whether Omicron is associated with more transmission, more severe disease, more risk of reinfections, or more risk of evading vaccines. Scientists at WHO and around the world are working urgently to answer these questions. We shouldn't need another wake-up call. We should all be wide awake to the threat of this virus. But Omicron's very emergence is another reminder that although many of us might think we're done with COVID-19, it's not done with us.
Well, South Africa's President Cyril Ramaphosa has condemned the decision by countries, including the US, Europe and parts of Asia, to ban flights from Southern Africa over the new variant, which was first identified by South African scientists. This is a little of what the country's health minister had to say in a news conference a short while ago.
There is just no basis for some of the leaders of countries which have imposed these restrictions on traveling for us in South Africa and other countries in Southern Africa. There is no basis for South Africans to panic. We've been here before. This is no new territory. We are now more than 20 months experience in terms of the COVID-19, the various variants.
So we've just heard from the Director General of the WHO saying there's a lot we don't know about the variant, including how dangerous it is, how transmissible it is, what will happen with vaccines around the variant. But some of the first answers we're going to get are from South Africa. So let's take you live now to Durban. Richard Lessels is an infection disease doctor at the University of KwaZulu-Natal. Very good to see you. Can you tell us, given the information you have so far, what we do know about the variant?
I think, as you say, there's a lot that's uncertain, and we don't yet know the specifics about how transmissible this is. But what we're seeing happening here, in particularly in Gauteng province, around Johannesburg, Pretoria in South Africa, is again quite rapid spread of this virus. And that means it's spreading rapidly in a population that we think has very high levels of immunity. From either past infection or from vaccination. And so that suggests that, yes, this is a highly transmissible variant. It can spread very efficiently from person to person, and also suggests that it may have got better at evading some parts of our immune protection. And really the question is now to unpick that and to understand the degree of that, and then, as you said, how severe is the disease that is caused by this, particularly in those people that have some protection from vaccines.
So absolutely, Richard, it's becoming clearer then about the transmissibility perhaps and the mutations of the variant, and on talking about the spike we were hearing about before. But that's a very crucial question. What are the kind of symptoms that people who are getting this variant, what are they experiencing?
I mean, so far, as with all the other variants, there's no suggestion that the clinical illness, the clinical picture is significantly different with this variant. And you maybe saw lots of reports over the weekend, kind of anecdotal reports that a lot of the cases are mild. But there we have to just urge a bit of caution that it's really too early to understand that, because a lot of the initial spread with this variant in Gauteng province was amongst the younger age groups, was in universities and the kind of 10 to 30-year-olds, because they're very mobile. The virus spreads often early in those groups. And so they're the ones that are anyway at lower risk of getting severely unwell and being hospitalized.
So Richard, so far you haven't seen hospital admissions go up, for instance?
We have seen hospital admissions go up, but most of those hospital admissions are in the unvaccinated still. And we're just unpacking to what extent the admissions are going up and how does that tie to the vaccination status or the prior infection status.
So if we can assume that this variant is more transmissible, I know that hasn't been conclusively proved yet, but there is lots of thought that it is. Does that mean that countries making decisions to reimpose border restrictions are doing the right thing?
No, because I think we've seen already within 2 or 3 days that these border restrictions are largely ineffective, because we continue to forget how rapidly this virus spreads, not just within borders, but between countries and continents. And what you'll see over the course of this week is this variant will be detected in most corners of the globe again. And so these border measures, just by the nature of this virus, tend to be too late to contain the spread, and clearly they do an enormous amount of damage in the process.
Richard, when we hear there are more than 30 mutations in the spike of the variant, 26 of those unique to Omicron, that makes it feel like it's quite different, say, from Delta and from Beta. Does that also mean it will make the vaccine more difficult to tweak?
I don't think it means that it'll make the vaccines more difficult to tweak. For many of the vaccines, that process is quite simple, of tweaking the vaccines once you have the genetic code. What we need to understand is whether that tweaking of the vaccines is necessary, or whether the protection against severe disease and hospitalization actually holds up very strongly, as we've seen with the other variants of concern so far.
Richard Lessell, really interesting to get your thoughts. Thank you so much for joining us from Durban.
Thank you.
Well, the UK has convened an urgent meeting of G7 health ministers to discuss the variant first detected in South Africa, and high on their agenda will be fears that Omicron could spread rapidly and partially evade existing jabs. The World Health Organization has warned it poses a very high risk globally, but says there are considerable uncertainties about the possible effect of the variant's spike mutations, as we've been discussing. Well, already Japan, a G7 member, announcing it's closing its borders to all new foreign visitors from tomorrow. So let's bring you the latest from Tokyo with Rupert Wingfield-Hayes.
Japan has had very tough border restrictions for most of the last 2 years because of COVID. Those began to be lifted on November the 8th, and now, just 3 weeks later, the Prime Minister said they're going back in. So this does not affect Japanese nationals, it does not affect residents, and it doesn't affect people who have multiple entry visas to Japan, but it will affect everybody else. That means foreign businessmen and women, obviously, and students, and tourists. Tourists were not going to be allowed in anyway, but so it's essentially business people and students. And it's really bad news for the students, because so many students have been waiting to get back into Japan to start there or resume their studies. They were very hopeful they were going to be able to do that this winter. Now it looks like they're going to have to wait again.
So lots of different pieces of reaction coming in today about the new variant, and we've just been keeping across an interview that has been given by the CEO of Moderna. They're one of the big pharmaceutical companies that is producing one of the vaccines, Stefan Bancel. Now, he has said, and this is really crucial, about the timescale we need for some of the data around the new variant. He has said that data on vaccine efficacy could be known in 2 to 6 weeks. So that, he says, is what they're looking for in terms of getting some clarity about about how effective the vaccine is, they need 2 to 6 weeks. That comes